Hello everyone, this is Dr. Naina. I want to welcome you to my show, NainaMD, Fusion of Science and Beauty. And today I've got a fabulous guest with me. Her name is Elise. She's one of the expert electrolysis locally and even throughout the nation. So tell me a little bit about why do we really need electrolysis when we've got so much laser treatments going on. We're all under the impression, and I as an anti-aging physician have so many lasers in my office, as you know. You work with me as well.
Sure.
And I do hair removal for so many clients.
Why electrolysis?
But exactly, why the electrolysis?
Well, I've been doing electrolysis and skincare for over 30 years, and with lasers, because I used to do lasers years ago as well, and they're wonderful and appropriate for light skin, dark hair. But anybody who has blonde, red, gray, or very fine hair, there's just not enough melanin for the light source in the laser to be attracted to kill. So people who have blonde hair and have excessive facial hair, or women who go through menopause that I sent you for the anti-aging, they all need, and women who have hair on their face, they want it off today. And with
Absolutely.
Laser, you're getting 35% each time. What are they doing with the other 65%?
And I think the audience sometimes is not really aware, because so many of the laser those treatment centers that advertise, people are under the misperception that it's permanent. And it's not permanent hair reduction. You really get a very fine coat, and that's not hair removal. Whereas electrolysis, I often send my patients, sometimes the laser treatments, when the hair is still not going away, they'll come for the electrolysis.
Well, it's the only true FDA true permanent hair removal.
Exactly.
Where the other is permanent reduction. And the other area that we're a very big area are people of color. People who are East Asian.
Because the laser, a lot of the laser is not good for all skin types.
It will
exactly.
burn or discolor their skin.
Exactly.
So we do a lot of African American ingrown. There are men with beards, and they have really troublesome problems. So we work very deeply with dermatologists, plastic surgeons, after men have facelifts, and all of this is brought behind the ear. We have to redesign
the hairline.
A new hairline.
Yeah, absolutely. So, and there's no way the laser is going to be able to do that.
No, you can't get it. You want it to look feathered and natural, so you want to do every third hair, so it looks like that's how God made it. Yeah. Not how a laser liner.
And I've seen you do it. It is very, very time-consuming, beautiful. I mean, you have to really know and to be able to precisely know which hair follicle that you're going to go after.
It's very much like microsurgery. You have to pick every individual hair to sculpt a hairline perfectly. I wanted to just share these with you. This is a hairline and eyebrows that I did. She had very heavy hairline, like little half-inch fuzzies here.
I see that. Look at that. That's, oh my gosh.
And thick eyebrows, and she's so much happier after. So that was just one lovely lady. And then this particular lady, who's just gorgeous, she's a model, she had all these little things hanging down.
My goodness, look at that.
And her eyebrows, and it just, by cleaning everything up, it's just a cleaner, fresher look.
This is really dramatic.
So we do a lot of celebrities, but they won't let me tell you who they are, because they want to think that they're perfect as they are.
I get the same thing. The other thing, you're an esthetician as well.
Yes.
And as we know that even the blonde and white hair, there are lasers there that are now currently available that will address that color of hair. However, it's still not as effective, I think, as electrolysis. And that's really what I wanted the audience to know, is that don't get frustrated if you can't get rid of all the hair, because there is another procedure out there. That's electrolysis, and it's been like around for so long, and yet it's kind of gone under the radar, and I don't know why, and I want to bring it out because I think it's very important and part of the anti-aging whole spectrum of how to take care of yourself, because we sometimes, especially on the face, we don't get all of that permanent hair reduction. So we really need that.
And it's very bothersome, like women who go through menopause And,
Oh yeah, and they get those chin hairs.
well,
and,
no, they get all that blonde
and that little
fuzz,
blonde
and then
fuzz
they go
as
to
well,
put on
yeah.
makeup, and it really shows up. And the other thing is there's a lot of women who can't have so much heat in their skin
Yes.
with the lasers, which we discussed because
Yes,
of
I have-
pigmentation
yes.
and anti-aging and
And you
hormones.
have to be very careful because because some women already have a lot of sort of, so to speak, a lot of heat. You know, in the Eastern, there's something known as the yin and the yang, and the too
Sure.
much heat and cool and so forth. So yes, I think there is a place for lasers, but there's an amazing place for electrolysis as well. Tell me about the Electrolux facial that you developed.
Sure. Well, you have to be an electrologist and an esthetician. And I found from my earlier years, people would come in with acne, and hair is usually what's the problematic problem. You're having those little hairs that are holding the debris and the environment and creating acne besides hormones and all the other reasons why you're breaking out.
Yeah, because that hair
Diet.
follicle has
It's-
all or surrounds all of it.
Yes.
It can produce inflammation.
Absolutely.
And once you get that hair out, you've
cleaned
free of
the
that.
whole face.
Yeah,
So
absolutely.
what's wonderful is if they do have a very bad acne lesion, I can go in, because wherever there's a hair, there's a pore. So you go in, you heat it, and then everything comes out like butter. So you're not damaging the skin, you're not bruising the skin. Then we go back in and we sterilize it. So when they come away from the facial, the bumps are gone, the pus and all of the debris is gone, and their skin is beautiful. And they're so thankful that it's not bruised and pigmented, because they already have that
Is there any
problem.
downside? Is there any side effects of electrolysis? Can you cause hyperpigmentation with electrolysis?
I've not in my 33 years, and if you're a bad anything, you can create bad things. But the skin is the paramount reason. I want you to have beautiful skin and no hair. Otherwise, what's the point? So, no, we're very gentle. We have 3 different machines. My partner, Karen Wolf, is a master electrologist and esthetician, and I have another, Gladys Valbuena, who's been with me for 18 years, and she's also a veteran of 30-some-odd years.
Yeah.
So-
yeah. Well, this is the place to be. I mean, I think
Yes.
I highly recommend that if you are going to seek electrolysis, then you definitely need to have somebody who is experienced. There is another extremely important place for electrolysis, and I think people don't often realize just how important it is, and that is in transgenders. Part of the anti-aging movement is the freedom to be able to choose how you want to live your life, how you want to be, and what gender you want to be. And we are getting a lot of good success in terms of the surgery. I do, of course, the hormone balancing and so
Yes.
forth of the transgenders. But at the end of the day, they need the genitalia. I mean,
Right.
we've got to go through that process. You cannot do laser.
And beards.
And then the
right.
beards. I mean, you cannot just keep doing lasers. I have so many laser machines, but I need to have somebody like you, because I have to have that electrolysis
We've been
procedure.
working with transgendered friendly practice for over 33 years. So I've watched many people move into their life and have the success of becoming a woman and removing entire beards, and the genitalia has to be completely permanently removed. It can't be partially
No,
removed.
absolutely.
So we work with nurses that do injections for lidocaine for a
Yeah.
pain-free experience, and many of my people go to you for hormone balance. And because what's wonderful about how you do it, and I'm so glad that I found you, because you really know what you're talking about, and you gently ease them into what they need so their bodies can produce and
Yeah.
make it, and it makes
Yeah.
so much
Keep
sense to
sensitized,
me,
yeah. You keep
because
the receptors
so many
sensitized.
people were just doing a cookie cutter kind of practice of, oh, here, use this much, and it worked, but
Hormones,
it
as I
wasn't
say,
work.
yeah.
Hormones
Yeah.
are so
Yeah.
valuable and sensitive, and thank you so much for your work. My people are so happy that they found someone who really knows their magic.
Thank you.
Yeah.
So tell me a little bit about when you do, is there any procedure that's as far as the facials in addition to the Electrolux? Because I know you do a combined, another sort of a facial. Which other facial is that you
It's
do?
called the vocal facial.
Yes, tell me
and
about that.
we do a lot of singers. Hello, we're in California.
That's what I was
and
so interested in.
actors.
This you have to hear this.
So the
audience has to hear this. This is amazing.
Sure. Basically, they're vocal cords before they're cutting an album
Right.
or a CD or whatever they do today. needs to be in perfect shape. So they come in and we do 2 different teas, throat coat and another tea that opens up the sinuses, and then double steam, and then we of course do the entire facial and make their skin glow, but it is lymphatic drainage, special pressure point a massage, totally relaxing and opening them up. And we do a lot of rockers after they've had a little bit too much party night beforehand, and they're like, oh my gosh, I have to.
And then they come on,
do
they're
a
going to get the IV
recording.
vitamin therapy, and
Now
then
they're coming
there's
to
a
you
great
for an IV,
combinations.
exactly. So we fix them up, put them back on the road,
Yeah.
and we have people that will go out to their homes and do these special treatments.
That's how seriously, that's how the elite and the people who are on the move and on the go, that's how they do it. You can't keep that kind of a pace without resorting to a few treatments that, you know, and this is what I really want to bring out in my show. I want my audience, I want everybody to be exposed to really knowing what's out there, and things that they've not even heard about. I don't think people have heard about electrolysis. Everyone just thinks, oh, electrolysis is outdated now, because
it's old school.
It's old school. We've got lasers now, and nobody understands that just how important it is in the Electrolux facial and the vocal facial, right?
Right, and having the IV and
IV
between all the wonder, and I send my transgendered and my men to do the big areas. You know, like bikinis, if they're blonde, they have to come to me. But anybody who's my skin coloring, lasers are fabulous. I did laser. I'm pretty much hairless except for, you know, where I'd like it.
Except where you need it.
Where I'd like it, right.
So tell me, where you've always been in Beverly Hills now, right?
I have. I've been in Beverly Hills for 33 years.
But you've moved across the hall.
I know. We're right here at 450 North Bedford, and now we're neighbors, which is so nice because I can just walk up the hall.
We do treatments together, and
we
things.
We do. I really appreciate that. And another thing I wanted to share for the transgendered community to know, now insurance companies are actually paying for their plastic
isn't that
surgery.
amazing? That's fabulous.
And for the genital electrolysis.
It's about time.
Right. So it's considered a medical situation where it should be paid for if you're going to change your life. And
well, that is so important.
we only have one life. Go be happy. You know.
Yeah. No, this is really good. This is all so good. Thank you so much for coming on my show, and
Thanks so much.
and you know, we have so much to catch up on, because you're actually showing me now how the electrolysis procedure is being performed. It is so precise.
Yes.
That's a take-home message. That electrolysis is so precise. She has to watch each and every hair follicle.
Yeah, it's like microsurgery. You're very treating the skin very tenderly, and it's just wonderful.
It's great. Thank you so much.
Thank you so much for having me. It's a pleasure.